Go. Okay. Hi, baby. Hi, Mom. I'm just coming to do the newborn assessment. So, start off by making it so I can reach your baby. Alright, just washed my hands. I'm going to check the ID band. Alright, Jordan Dormer. So that checks out with my chart. I'm going to start off by doing some vital signs. And as I'm doing my assessment, I'm going to try to keep you as warm as possible. Okay? So I'm going to put on the oximeter. Take baby's temperature and do it under the arm. The temperature range should be about 97.7 to about 99.5. And it's right in between there, so the baby's good. Okay. Put that down. I'm going to go ahead and I'm going to take baby's pulse. I'm actually going to go ahead and I'm going to listen to it. I'm going to take it for a full minute, too. The normal pulse should be between 100 and 160. Good, it's about 120. And then while I'm here, I'm going to go ahead and I'm going to listen to baby's respirations. I'm going to listen to it for a full minute as well. And it should be between about 30 and 60. Good. And then while we're here, we're going to go ahead and listen to baby's heartbeat. Sure it's regular. Good. Then we'll get some breath sounds from baby. Good. Okay, so I'm going to start off by checking baby's head. I'm going to remove the hat really quickly. I'm going to be checking for molding while I'm here. And so basically that's just some overlapping of the cranial bones. I'm going to check the fontanelles, which are the soft spots as well. And the suture lines, which is separating the cranial bones. I'm going to check for some edema in here, which if it's soft and squishy could just be the caput succedatum. And then if it's a hard edema, it's going to be more of like a cephalohematoma, which would mean that there's blood underneath the baby's head. It looks good. No scratches or bruising. Okay, I'm going to put the hat back on to keep baby warm. I'm going to check baby's eyes next. And the placement looks good. It's about 1/3 of the one eye, 1/3 is between the nose, and the other third is the other eye. Symmetrical. There's no discharge coming from baby's eyes. I don't see any subjunctival hemorrhage, which would be a red patch in the baby's sclera of the eye. And then the epicanthal folds isn't existent, which could indicate the Down syndrome. Okay, then I'm going to move to the baby's ears, which they're in position in a straight line with the eye canthus, the inner and outer canthus of the eye. And then I don't see any discharge from the baby's ears either. I'm going to check the baby's ear recoil. There's a lot of cartilage, and it was a fast recoil, because if it was a slow one, then that could indicate prematurity as well. I'm going to check the baby's nose patency. So I'm going to go ahead and I'm going to close one nostril. I'm going to feel the air flow from the other one. And I'm going to close the other one, feel the airflow from that one. I'm going to go ahead and I'm going to put gloves on so I can check baby's mouth. I'm struggling because I'm sick. I'm going to go ahead and check the patency of baby's mouth by sticking my finger in. I'm going to rub the top part of the baby's palate. And then I'm going to turn my finger over, and the baby's sucking, so that's good. Okay. Go ahead and I'm going to toss these in the trash. I'm going to check baby's neck for any masses. And I don't see any. Feel any. We're going to turn baby's head from side to check range of motion. And it's moving really easily, so that's good. Baby's clavicles are intact. Okay, I'm going to check baby's skin. So I'm going to do it quickly so we can keep you warm. Okay. There's slight peeling, which is normal. The baby's nice and pink, which is good. I don't see any rashes. There's no birthmarks that I'm noticing. Still try to keep you warm here. I'm going to check the back for some lanugo. And there's some on the back. And then I'm going to check baby's thigh for a skin turgor, which is good, means it's well hydrated. Next I'm going to check for jaundice. So the first place that I'm going to check, and I'm going to press down to blanch it. I'm going to check baby's forehead, and that's good. Check the inner thigh. Good. I'm going to go ahead and check the abdomen and chest. Good. And then I'm going to check baby's eyes. And it's white, so that's good. The next thing that I'm going to do after jaundice is I'm going to do a respiratory assessment with baby. I've already checked the breath sounds, so I'm going to look for more physical examples of signs of distress in the baby, which would be like nasal flaring, which isn't noted. I would look for retractions in the ribs while baby's breathing. It's little indentations in the rib cage. I would also listen for grunting from baby. I would check the chest and abdomen for seesaw respirations. They should be going up and down at the same time versus opposite. I'm going to check for apnea with the baby, which is if the baby stops breathing for more than 20 seconds. And then the baby looks good. So I'm going to check the abdomen next. I already listened to the bowel sound, so what I'm going to do is just make sure that the belly's flat and soft, which it is. It's not distended. I'm going to check the cord while I'm here, which this diaper should actually be folded down so it's not messing with the cord. I'm going to check for the level of dryness, and I'd say that it's drying right now. Okay. And then while I'm here, I'm going to go ahead and I'm going to assess baby's genitals. Still keep baby covered as much as possible. And I'm going to put gloves on. Okay, so it looks like baby's diaper doesn't need to be changed, thankfully for me. We have baby girl here, so I'm going to check the labia. Normally it's a little swollen after after birth, but there's, I'd see a little small bit of blood discharge, but that's normal, so we're just going to wipe it away. If this was a male baby, I'd check and see that the testes are distended. I'd check to see if the meatus is on the tip of the penis instead of underneath or above. And then I would check the foreskin as well. During this time, I asked Mom when the last stool was, when the last void was, because we want to keep track of that. And then also be aware when I'm putting the diaper back on to fold it down so it's not in the way of the umbilicus. And then see when the baby's last been fed, because it should be every 2 hours. Okay. Wrap baby's legs back up. The next thing I'm going to check is the muscle tone of baby, the resist and recoil. So what I'm going to do is I'm going to take baby's arm, I'm going to flex it for 3 seconds, I'm going to extend the arm, and then I'm going to let go, and baby's arm should come right back up, which is good. And then while I'm here, I'm also going to check for the palmar creases. If there's a single crease, then that could indicate a sign of Down syndrome, but I'm seeing multiple on baby's hands, so that's really good. There's 5 fingers on baby's hands, as is supposed to be. And then I'm going to go ahead and I'm going to move to baby's sole. Okay, there's 5 toes on baby's feet. If baby has a lot of the palmar creases, it means that it was a term baby. If there's few of them, or like 1 or like less than about like a third, then it could indicate prematurity. And then I'm going to do the Babinski reflex. So I'm going to start at the bottom of the foot and I'm going to curve around to the toes, and the toes should flare, which is good. And then I'm going to go ahead and I'm going to roll baby onto its back or belly. Okay. And while I'm here, I'm going to check baby's spine. I'm going to move the blanket so we don't have any SIDS. I'm going to check baby's spine. There shouldn't be any tufts of hair here. I'm checking for dimples. If there's tufts of hair, it could indicate spina bifida. I'm also going to look at the creases right here, which checks for the symmetry of the baby's hips, which is really good. So let's roll baby back. And then we're going to check the Moro reflex, which is what I'm going to do is I'm going to slap the table and see if baby gets scared in a sense. Baby's arms should flare out and then come back in. So, and it did it, so that's good. And then during this whole time, I'd be assessing baby's behavior. If baby's been crying, sleeping during the assessment, awake, alert, such as that. And then just continue with trying to keep them warm and doing this as quick as possible to make sure baby's comfortable, warm, and safe.